Okay. All right, we're going to let Leisha begin the program.
We're doing the best we can to listen.
It's so hard in these masks. Good afternoon. I'm Leisha Bowman. I'm the Assistant Chief Nursing Officer and Director of Labor and Delivery here at UT Health Tyler. Thank you for joining us to celebrate the construction of our new neonatal intensive care unit. We are so excited to offer this advanced level of care for families in our community. This will allow babies delivered at UT Health Tyler to remain with their parents in the rare event that they need neonatal intensive care. With a NICU, we also will be able to transfer high-risk mothers and infants from our regional hospitals in Athens, Henderson, and Jacksonville who previously were sent to Dallas for care. This will allow our families to remain close to home during the difficult time of having a baby in the NICU. Because we had to limit our attendance at today's event, there are a couple of things we're doing to help make this a more memorable occasion. First, we have an orange shovel that we'd like to keep as a keepsake for our unit. I would love if those of you who are here today to sign it before you leave. I'll also be inviting our obstetricians, pediatricians, neonatologists, and caregivers in our labor and delivery team to sign the shovel as well. Secondly, we are working with the City of Tyler to donate 9 trees to symbolize the 9 neonatal beds that we will be adding. The trees will be planted at one of our area parks in early spring, and we will have photos to share with you at that time. I'd now like to invite Dr. Doshi with Millennium Neonatology to give a few remarks about the higher level of expert care that his team of neonatologists will provide in our NICU. Dr. Doshi.
Thank you, Leisha, for the introduction. And to guests both here and virtually, thank you for taking time out of your schedules to be with us today. And thank you to UT Health Tyler for this collaboration. So my name is Dr. Snehal Doshi, and I'm the CEO of Millennium Neonatology. I'm both a practicing neonatologist and physician now for almost 20 years. I have lived in Texas almost all my life and currently reside in Southeast Texas. I actually trained at another UT facility, University of Texas Medical Branch in Galveston. And I still train their medical students today, both in general pediatrics and neonatology. And we plan to do the same here in Tyler. So what is a NICU? So in a neonatal intensive care unit, or NICU, babies are taken care of that need extra help to manage the transition from being born to being a healthy baby when they go home with their parents. Babies can be born early or premature and will have to go to the NICU, but also babies can be born on time and develop special problems that require an extended stay in the NICU. In general, 1 out of every 7 to 10 babies born in the United States is admitted to a NICU. Babies may have to go to the NICU for a variety of reasons, from simply getting cold, to dropping their blood sugar and not being able to eat well, having breathing problems requiring specialized machines such as ventilators, to having infections or seizures that require treatment. A whole host of problems could potentially face a newborn baby and their parents. These infants are fragile, and oftentimes, they're the sickest patients in any given hospital, and they need special medical attention right away. Having a sick child is a frightening time for parents, but knowing what to expect can help them feel less afraid, and the addition of a NICU will help ease those tensions for those families right here in East Texas. Having a NICU also allows our OB partners, including Four Seasons Women's Health, Dr. Saeed, Harris, McClintock, and Tyler OB-GYN, as well as other OBs in East Texas, to be able to deliver and care for their patients safely with the neonatologist of Millennium Neonatology, working hard to ensure that each and every infant and their families are taken care of. Our neonatologists provide around-the-clock care and supervise a multidisciplinary team to support all of our infants and are available for any emergency at a moment's notice. Babies that go to the NICU could stay for as little as a few days to sometimes months. Each baby is different, and each baby requires specialized equipment. From several types of breathing machines, specialized monitoring equipment, and computer systems, to even a transport isolette, which is like a mini NICU on wheels. We will now have the ability to bring infants from our surrounding hospitals and keep almost all infants together with their parents at UT Health Tyler. No longer will infants routinely have to leave town to get the care that they need and deserve. This in turn will make it easier for our families to be able to stay together during the difficult time of having their child or children in the NICU. In the fall of 2021, the NICU will open with 9 state-of-the-art neonatal beds and equipment ready and willing to provide care for the sickest infants in Tyler and East Texas. The vision to bring this project to completion in such trying times such as these would not have been possible without the dedication of our physicians, our staff, but most importantly, the support of our community and our patients' desire to improve the quality of care in East Texas. I'm happy to be a part of this important new addition to UT Health Tyler. Thank you.
Thank you so much, Dr. Doshi, and thank you guys again for joining us today. We deeply appreciate all of your support, and we're excited about the advanced care that this NICU will bring to our hospital and our community. Don't forget to sign the shovel before you leave, and thanks so much for coming.